Hi, I'm Dr. Travis Rose at Peak Form Health Center, and what I want to do today is show you a generalized treatment for lower back pain. My patient here has been dealing with some general low back pain across the lower part of the back here for about a month or so now. It's worse with squatting and some other strength training exercises like leg press, and also when he's driving out for long distances, a couple hours at a time, he'll get some generalized achiness into his lower back here. So upon the examination, we found that he has an anterior tilt through his pelvis, which is putting some compression into his lower back. That's tightening up the muscles here in the lower back, and then he's also exhibiting some tight hip flexors in the front, and those hip flexors connect into the back, pull into the back, and can cause a lot of joint pain. So what I'm going to demonstrate is how we address this in the office, that it's not just an adjustment approach, that we're going to be working with the muscles to try to loosen up these areas and then get him on a rehab program so he knows how to manage this on his own. So the first thing we're going to do is address the musculature up here and around the top part of his hips, and then we're going to work into the hip flexors. Okay, so this first one, what I'm going to have you do is bring your leg up like this. Start with the leg in, and when I tell you, just rotate the leg all the way out for me, okay? Okay, so go ahead and rotate the leg all the way out. So what we're doing here is we're using his hip muscles to help pull into the lower back while stretching out the erector muscles of the spine. Bring the leg back in. Go ahead and go. And having the patient actively move while we're doing the deep tissue release to the muscles helps a lot with the pain sensations as well, because working through tight muscles can be slightly uncomfortable. Now we'll do this on both sides, but for demonstration purposes, we're just going to move on to the hip here. So now on this side, what we're going to do is, okay if I lower the shorts on this side? Mm-hmm. Okay. So we're just going to expose a little bit of the gluteal muscles here, and we're going to bring this leg back up, start in, and then this one you're going to rotate out, and you'll rotate back in for me, okay? So go ahead and rotate all the way out, and bring it back in. There we go. So now I'm keeping pressure into the hip muscles here, because when we examined the hip, he had a lot of knots, a lot of trigger points, which can contribute to some instability of the lower back and hip. Go ahead and go. And can be very painful themselves. Bring it back in. So we want to work on these tissues, try to get them loosened up, and that will help a lot with the pain and dysfunction he's having. And one more time, go ahead. And now bring it back in. Okay, good. Now relax that leg. Okay, now go ahead, lay on your side for me, facing the camera, if you don't mind. Set that there. Okay, so now we're going to work into one of the hip flexor muscles in this position. So this is going to be right on the inner part of the pelvis. The muscle is called the iliacus. So we're going to start with the leg right there, and what I'm going to do is just work right into the front part of the pelvis there. When I tell you, you're going to straighten the leg all the way out and bring the leg back off the table like that, okay? So start there, let me get set up. And relax the leg for a second. Now press up into my hand. Okay, just making sure I'm on the right part of the muscle. Now go ahead and straighten that leg out. Go ahead. Good, 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 and bring it back up. And go ahead and go again. So again, working the hip flexors, take some pressure off of that lower back. Go ahead and back up. Do one more and go. Good, okay. Now the last muscle we're gonna work on, go ahead and lay on your back for me. Okay. And scoot to this side of the table. Okay. So now we're gonna work a little bit into his quadricep muscle, specifically the rectus femoris muscle. That muscle attaches into the front part of the pelvis, runs down to the knee. And what we want to do is loosen that up to take some pressure off of the anterior or front of the pelvis, so that then it loosens up the pressure on the back. Okay, so from right here, keep the leg straight. When I tell you to go, just bend the leg all the way back. So let's do a few passes here just for demonstration purposes. Go ahead and go. Good, and back up. Go. Pressure okay? Mm-hmm. And back up. And go. Good, and back up. And go. So I'm feeling for the tension in the muscle, trying to hit the tighter spots with some pretty significant pressure. Bring it back up. And for that protocol, we would actually follow the muscle all the way up to the front of the pelvis to try to take as much tension out of the front side of this pelvis as possible. So that is a pretty standard treatment that we do here at the office at Peak Form Health Center. And this is a good way to correct some of the muscular imbalances, and then we're going to get our patient on a rehab program to strengthen some of the posterior chain muscles as well as the deep core muscles.